This is a very unique trial in which we test the hypothesis of if we teach a community how to improve their health against obesity and diabetes, can that have propagative effects on more than just the individual that we teach? And can the benefits go beyond just in any individual? Hi, I'm Dr. Eric Weigel-Ding, and I have with me my co-author and colleague, Dr. Daniel Zugby. We're very excited to announce our publication, Social Induction via Social Behavioral Intervention on Changes in Metabolic Risk Factors, a randomized control trial in rural Appalachia. Our paper is focused on social networks. It's kind of like if you give a person a fish, you feed them for a day. If you teach them how to fish, you feed them for a lifetime. If you teach them how to teach others to fish, can you feed a community for a lifetime? And I think that's the general premise of this social induction. And notably, our results are 10-month intervention plus a 6-month follow-up period. During our intervention, we found there was significant weight loss in the intervention versus the control group. Again, it was a randomized trial. The weight loss was approximately 6 pounds. And we also had significant decrease in waist circumference and many other metabolic risk factors. But more than that, the benefits were also sustained over the follow-up period. So once the intervention ended, we had sustained decreases in weight loss and waist circumference. But furthermore, the theory that we're actually testing is there social propagation? Is there this social induction? In our novel index social induction ratio found that yes, indeed, the effects were due to greater social propagation. And we found that in our multi-level analysis of the classrooms in which individuals participated in. So if you had lost weight, you were more likely that people around you were also more likely to lose weight. So this cascading effect was exactly what our hypothesis was and theory tested. And so for the implication, I'll turn now to my colleague, Dr. Daniel Zugby.
Hi, my name is Daniel Zugby, and I'm from the University of California, Berkeley. I'm delighted to be a part of this publication. I think really what it's about is the concept of contagious health. The idea that good behaviors, like bad behaviors, can be spread through social networks. We think about eating unhealthy food, smoking behaviors as being sort of negative behaviors that can be spread through social networks. But what we've tried to do is really flip that and to ask the question, well, can good behaviors actually spread through social networks? And if so, how can public health sort of create an intervention that can achieve that outcome? I think another really important and interesting aspect of this research is the fact that this was done in a low income, under-resourced community within the United States, rural Appalachia, Kentucky. You know, these types of communities that do not have a lot of financial resources do not have the ability to sort of put people on expensive weight loss drugs. Instead, what we've created is a very low cost intervention that actually harnesses the existing social capital in the community. We bring people together as groups of people who know each other, care about each other because they're part of the same community and they want to create a healthier life for themselves and for their family. And I think what this opens up is really the possibility not just for a low-cost intervention, but a low-cost intervention that actually has the possibility of scaling throughout the community, throughout the state, and so on. I think the final point that I really want to make is that this is just the beginning. Discovering something about the way in which social networks can improve cardiometabolic health is one thing, but to figure out how this can be further optimized, how it can be maintained longer and longer and longer in terms of the cardiometabolic improvements, and finding out how public health systems can easily sort of stand up systems like this in different geographical contexts within the United States and also globally. I think it's going to be a really, really crucial area of research in the coming years.
I think this project is also very unique because, many times in public health, we have an intervention, but the moment the intervention stopped, the benefits stopped. The moment the people who deliver the intervention leave, the people remaining, and especially in the rural area of Kentucky, no longer have access to the resource. And I think the implication of this social network research is that if you can build something that is self-sustaining, that it will have lasting effects for a long period to come. And especially in a way that could be self-sustaining and propagating to those around them. Because on the flip side, if negative behavior such as smoking can be socially influenced and negative diet, alcohol drinking can be built into a community, why can't we flip it around? Why can't positive health behaviors that reduce obesity and diabetes be leveraged so that they can be self-sustaining in a community? And I think that is the long-term question and long-term impact of our work that we hope this project will be carried on and will be the impetus for many other follow-on projects down the road.
We're really excited to have you read what we've come up with, and we hope you'll check out the July 2024 issue of Mayo Clinic Proceedings. Thank you very much.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.